big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
Here's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're going to lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that, for you, for her. Now, thank God that she had successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house, you're going to lose your home, you're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're going to need it. For you, it's probably going to be a couple years, all right? Because I could tell you've probably been eating butter and fried chicken for the last 20 years.
Hello, what's good, everybody? Welcome back to Global Views with Josh, the channel where we connect the dots, we redefine print, and yes, occasionally laugh so we don't scream. Now, today's story is a classic case of FAFO economics meets political amnesia. Because right now across MAGA country, we've got Trump voters in full meltdown mode after discovering, brace yourself, that their healthcare coverage is on the chopping block. And the collective reaction, wait, this affects me. Really? Oh, so now it's a problem, you know it's affecting you now. So let's talk about it.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we want to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these tapping nuts in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people they're hurting are those poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
For either one.
You just wouldn't have voted.
Not either.
Did you guys see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
Hey, real quick, to the almost 250,000 Oklahomans who are about to lose their Sooner Care, I want you to know that it was Republicans that did that, okay? 3 times, House Democrats were trying to save your health care. We're trying to save Medicare, Medicaid, and Sooner Care for Oklahomans. And 3 times, Republicans voted against it, okay? They wanted to put an amendment that says, hey, if you make $10 million or more, then you don't get a tax break, and that will help save health care for Americans. And House Republicans voted no. And then they tried again. They said, hey, people making $500 million or more, how about we not give them a tax break and save Americans Medicare and Medicaid and your Sooner Care? And they voted no. Republicans unanimously voted no to not save your Sooner Care. Oh, and then they tried a 3rd time to try to save you and your health care, and House Republicans voted no. They voted no because they wanted to give billionaires who already have enough money to spend $1 million a day for the next 500 years. But no, they need more money. They need more money. You don't need your health care. You don't need it. You don't need health care. Who needs health care? Those billionaires deserve another tax break. They deserve that money because they worked hard. They worked for that tax break. You obviously didn't work. That's why you don't get your health care. So anyway, when you lose your health care, when you lose your Sooner Care, you can thank Republicans for that. So when they start kicking out old people and they start not accepting old people in the nursing homes because they don't have those benefits anymore, again, I want you to thank Republicans for this, because this is what you voted for. This is what you voted for them to take away your Sooner Care, for them to take away your Medicare and Medicaid. Because what's more important, the American people being happy and healthy, or billionaires getting tax breaks? The answer is billionaires getting tax breaks. That's what's more important to our politicians in this country. So just so you know who to blame when you lose your health care, may you have the day you deserve.
It's Sunday and you're going to enjoy the football game, but tomorrow will be Monday. And tomorrow we will still have millions without health care. We as a country are the most expensive health care in the world, and we don't even cover everybody. People are dying to have health care, and we can't figure that out in America. And 100,000 or plus every month of job losses, millions of children going to bed without enough food to eat. Yeah, and now we have the FBI coming out and going, yeah, the whole Epstein thing, yeah, it really wasn't a trafficking thing. It was, yeah, there's not much there. That's America today. Yeah, that's the country you live in. I live in. And it's just, there's so much to be done. And there's just no will to do it. Nobody's talking about doing these things. No one. We keep talking about all kinds of other stuff that don't mean anything. If you don't have your health, if you don't have access to health care, you don't have anything. And that's why, America is supposed to be the land of the free. We're not. You're not free when you can't get basic health care. When other countries all around the world have access for free, and we have millions of people that can't get even the most basic health care in the richest country in the world. What does that say about us?
All across red states, people who proudly voted for Trump, sometimes twice, sometimes with a flag, a hat, a bumper sticker, and a Facebook profile picture, are suddenly panicking. Why? Because Medicaid expansions are being rolled back, Affordable Care Act protections are being weakened, work requirements are creeping back in, hospitals in rural areas are shutting down, and insurance premiums, of course, let's just say they are not great again. Now, these same voters are calling into radio shows, town halls, and local news stations saying things like, I didn't think they meant my health care. I voted for Trump, not for this. Nobody told us we were gonna lose coverage. Sir, ma'am, Detroit with the eagle profile pic. They told you repeatedly, loudly, in plain English. So let's get something very clear. This isn't a bug. This isn't an accident. This isn't unexpected consequences. This was the policy. Trump and MAGA Republicans have never hidden their hostility toward the Affordable Care Act. They tried to repeal it dozens of times. They gutted the individual mandate. They cut outreach funding to the program. They supported lawsuits to kill it entirely without a replacement. Now, remember, repeal and replace? Yeah. Turns out, replace was just the vibe. And now, fast forward, the same voters who cheered all that on realizing that ACA wasn't just some abstract Obamacare thing for other people. It was their insulin, their cancer screening, their kids' coverage, their rural hospitals. Oops. So this is what the internet lovingly calls the find out phase. You voted for politicians who promised to cut government handouts, and now you're shocked that the handout you relied on got cut. You voted against socialized medicine and then realized private insurance doesn't want to insure you once you're sick, older, or poor. You laughed at liberal tears only to discover the hospital bill doesn't care who you voted for. Capitalism said, good luck though. What makes this moment very or truly chef's kiss is the selective outrage. When healthcare cuts were framed as hurting immigrants, poor urban communities, or blue states, silence, shrug, personal responsibility. Remember that quote. But now that it's affecting white, rural, working class Trump voters, suddenly this is unfair. This isn't what America is about. Someone need to do something. Oh, really now? You worried about fairness? Now, here's the uncomfortable truth. A lot of these voters believed there was a hierarchy of who deserved help. They thought cuts would hit other people. They thought exemptions would magically apply to them. They thought loyalty would protect them. But the policy doesn't ask who you voted for. The algorithm doesn't check your MAGA hat. The insurance company doesn't salute the flag before denying your claim. You are not the exception. You are the data set. And where is Trump in all this? Not at a hospital, not at a town hall, explaining solutions, not unveiling a healthcare plan, because, spoiler alert, there still isn't one. He's busy ranting about enemies, retaliation, or relitigating elections and fundraising of grievances, healthcare. That's your problem. And somehow, some way, he'll still blame Democrats, immigrants, or the deep state, while his own voters lose coverage under policies he backed. And many will still cheer. So this moment isn't funny because people are losing healthcare. That part is tragic. What's ironic, even darkly comedic, is how predictable it was. Elections have consequences, policies have victims, and vibes are not a substitute for governance. You can vote on slogans and be shocked by spreadsheet. So here we are, Trump voters discovering that FAFO isn't just a meme, it's public policy. Healthcare stripped, promises broken, and accountability is still missing. But I'll leave you with this. If these voters finally feel the pain, will it change how they vote? Or will it double down and blame everyone except the people they empowered? Now, is this a wake-up call or just another chapter in the same circle? Drop your thoughts in the comment section. Argue respectfully, or it's you too. Argue respectfully. Tell me what your thoughts are. If you enjoyed this breakdown, like, share, and subscribe to Global Views with Judge, because here we don't just watch history happen. We ask who's paying the price. I'll see you guys on the next video. Credit belongs to original creators.